Arsalan. Today we're presenting on projects on improving culturally sensitive healthcare among Arabic-speaking refugees and primary care physicians. With me, I have Nushin, Kathleen, Ivan Nasa, Ali, Saadat, and Mo. So, thank you. Thank you. An Arabic-speaking refugee named Rahman walks into a primary care clinic. Rahman is a newly arrived refugee, and his main complaint is burning urination. His primary care physician associates this symptom as a possible symptom of a sexually transmitted disease and orders an STD test for Rahman, despite Rahman indicating that he's a devout Muslim. Rahman's primary care physician isn't aware that Muslims practice abstinence before marriage due to religion and orders that test. This offends Rahman. Rahman loses his trust in his doctor, their personal relationship gets compromised, and Rahman leaves the clinic without receiving proper treatment. So the question that comes up is that how could we have improved Rahman's experience? Of course, this is one of the many situations that a cultural gap between a primary care physician and their refugee patient could lead to inadequate health and well-being.
The goal of our intervention is to bridge the cultural gap between primary care physicians and their Arabic-speaking refugee patients at the Community Health Center of Buffalo. We plan to do this by increasing physicians' awareness about beliefs and attitudes that can influence delivery of healthcare services. Our main objective is that by the end of 2025, we want to increase reported satisfaction in primary care visits by Arabic-speaking refugees in community health centers of Buffalo. We plan to do this by promoting patient-centered and culturally sensitive healthcare. If our intervention is successful, then we can expand this to other populations and healthcare facilities.
So, how are we going to actually achieve this? Well, our intervention revolves around a development of an internship program that we're calling Care for Refugees. We are creating an opportunity for students to get course credits or also use this as an internship opportunity. We're trying to reach the students from various disciplines within the UB community, and mainly the Arabic-speaking students, to create the language as a common factor between our refugees and the student volunteers. Students will engage with refugees through personal conversations prior to meeting physicians. And students will then summarize a culturally relevant information regarding patients' perceptions and beliefs regarding healthcare, then included in the electronic medical record for physicians to have access and not have to spend so much time trying to get to know them on a personal level. We also plan to reaching out to organizations such as Organization of Arabic Students, Office of International Student Services, and also collaborate with Jefferson Clinic, who would be closing at the end of this year. So we're hoping to include some of the volunteers that work there to help us in our process as well.
So when selecting our volunteers, our interns, we'll make sure we consider their schedules and their availabilities to ensure that there's coverage throughout the week. And we would like to partner with UB faculty members as well, such as Dr. Griswold and Dr. Ram, to facilitate the educational needs and ensure there's course credit can be allotted as well, and to provide training for these students. Faculty from different disciplines will be involved with the training of these students to ensure that the communication skills are adequate and to make sure the delivery of these questions from explanatory models that we'll be explaining later are used in a way so that there's an open, non-intimidating conversation. So students will also be trained in HIPAA, which is the Health Insurance Portability and Accountability Act. So this will ensure that refugees, that their health information is protected, and that there will be patient confidentiality as well. Overall training will be short, around 3 days.
So as just mentioned, the interns will be using questions from 2 different patient explanatory models. So one is for health and one is for illness. So these are just basic questions to get to know about the refugees' health perceptions and then illness. The health model will be given at the initial assessment, and so then as the physician gets to know about the general health beliefs, and for the later visits, the intern will then give the second model, which is for illness because that is disease focused. So these are only a starting point for the interns. They will not be following these questions word for word. These are just to create a dialogue with the interns who also have a common link with the refugees to start a conversation about their health.
This is where the comprehensive training will become relevant, since the student will apply their skills during the one-to-one interaction, where they will be engaged in conversation with the refugees and grasp the relevant cultural information to share with the doctor. And the interns who speak the refugee language and come from culturally similar background will create a friendly and trusting environment to encourage the patient to be honest and open, and to have an open relationship.
Okay, so from those models, the interns will be creating a distinctive bullet points, or what they think are the most important cultural information. And so they will write these bullet points and then leave these bullets in the electronic medical record for the physician. So these bullets save times for the physician, and then the physician can then consider these points and apply in the practice. And then we will also, to measure our overall objective, which is to increase satisfaction, interns will also see the refugee before they leave their visit and ask about their visit. And they will make a record of this, and this will be our surveillance mechanism for our intervention. So again, the volunteers are the bridge to connect the patients and the physician by providing this information to them.
Now, our very own Dr. Kim Griswold conducted a study interviewing medical students that actually interacted with refugees. Now, through the result of this interaction, they gain enhanced experience with cross-cultural communication and interpretive services. This shows how refugee interaction can occur with just medical students. And in another study listed below, it focused on the use of the explanatory model you've seen in the previous slide among the South Asian immigrants. And through that, the research showed valuable information regarding the healthcare needs of a group diverse in nationality, culture, ethnicity, and religion.
So one primary benefit is that the increase in culturally sensitive care will improve the trust within Arabic-speaking population to the medical community. This will lead to better adherence to medical recommendation by the physicians, which will eventually improve the health outcomes and the well-being of the Arabic-speaking refugees. A secondary benefit is that so the UB students or the future physicians will be exposed to this culturally sensitive care, and this will bring awareness of the health issues within our refugee population.
Ladies and gentlemen, collaborators, partners, judges, coaches, and students, I want to tell you all that our innovation is a win-win-win situation for everyone. With our innovation, refugees will be getting a culturally sensitive healthcare. Our primary care physicians will be able to build a strong relationship with their refugee patients. Our students who are passionate about working with refugees have the opportunity to get engaged in the community and help the refugee patients. So I want to bring back the question that we asked in the beginning. Can we help Rahman and people like Rahman who have the same experience with primary care physicians experience a better healthcare visit with their primary care physicians? Can we bridge this gap between primary care physicians and their patients who may be from completely two different cultures? So imagine that our innovation, just 20 more seconds, our innovation, if was implemented, Rahman's cultural belief would have been taken into consideration. So can we help the hundreds of Iraqi and Syrian refugees that will be coming to Buffalo feel safer about their health? I say yes, we can. With our innovation, our motivation, your resources, and with your expertise, we can make Buffalo a model city to provide healthcare to refugees. Thank you very much.
Please don't drop the mic. We need